Hello, a very good evening to all of you. Today we are going to discuss a case note of Miss Annette McNamara, and you are writing a letter to the director, Blue Nursing Service, 207 Sydney Streets, West End. So, why you are writing this letter is to be found. This is a small letter. It's not a complicated letter. So the reason why you're writing the letter is to organize daily visits. I'll show you. To organize daily visits from this Blue Nursing Service, to assist with showering and to dress hand. So this is the specific reason why we are writing the letter to the director of Blue Nursing Service. Number one is to assist with showering. Number two is to dress hand wound. So the other things are assigned to some other people. So you are assigned to do these two services. Social worker is to organize meals on wheels in physiotherapy. Nice will visit to help household and shopping. That is a different task. So your task is to assist with showering and to dress hand wound. So you have to keep that in mind. And let's go ahead with the first. Now, let's see the beginning. You are Grace Jones, a qualified nursing sister working in Ward C25, Princess Alexandra Hospital. So your ward name is given, your name is given, today's date is given, your hospital name is given. Now, the patient name is given, date of birth is given. These all are things we need to note it. Now we have to go with the social background, which is important here. The single age pensioner, and she has a recent shift in her accommodation. She moved to a small accommodation in the new suburb, where she was living in a different location. She had been living for 10 years in a different accommodation. Now, because of this reason, she is feeling isolated and lonely, and she is facing some transpiration problems. And it is impossible for her to attend her regular bowling session and bridge club, which she used to attend before when she was in the previous accommodation. Now, we can see a niece who is visiting her every 14 days. That is Stella Atois, and the number is also given there. Now, so we have the date of admission and date of discharge. And one thing that we need to be very cautious when you write the date of discharge, that this is not a confirmatory date of discharge. This is this is an optional discharge date. We have not made the final decision of discharge. This is an expected date of discharge. This is an estimated date of discharge, because provided no complications and home assistance arranged. So if she has no complications and if her home assistants are well arranged, then we'll be discharging her on 22nd of this month. If she has complications, if her home assistance was not arranged, she will not be discharged on 22nd of this month. So this is something which is very crucial when you write the letter. This is not a confirmatory date of discharge. Now she has she was admitted to hospital following a fall. Slip, fell descending stairs to put out garbage. X-ray revealed fracture right wrist, laceration left cause from broken glass. So these are all things what happened in detail. She had lacerations and bruises, all these things. And the third thing is that she had a broken right wrist because of the fall, an accidental fall, which she met with at her home. on 20th of this month. Now we have Carvia 150 mg daily, and we have Normicin and Panadol. These are the drug of choices that we gave at this hospital. Now the discharge plan, we have seen it earlier. Now let's go with the letter here. I'm writing to inquire whether daily home care services can be provided for Miss Annette NAMARA, who is expected to be discharged tomorrow. So she's expected to be discharged tomorrow. That's the information here. I just need to inquire whether daily home care services can be provided from your facility for Miss Annette McNamara. I need to confirm whether you can provide daily home care services or not. We need to decide on her discharge tomorrow. So this is the first step. She is recovering from injuries due to an accidental fall. So she had injury. She had bruises, lacerations, and a broken wrist here. So she has injuries there. So that's what we have written. We are going to focus on injuries rather than the fracture, because she is not going to give fracture care. She's going to give wound care as well as assistance in showering. So Miss McNamara was admitted. So why we have written McNamara is that we have to write the surname is McNamara, like as we say in McDonald's or Macmillan's, like that. So please don't write simply Miss Namara. So McNamara was admitted after the aforementioned incident to the hospital on 20th of this month. So it was on 20th she suffered this problem. There were lacerations on her left hand caused by broken glasses, along with severe bruises on her right shoulder and lower back. So what exactly happened in the fall, we have mentioned here. In addition, an X-ray of her right wrist was taken, which revealed a fracture. So where she suffered an X-ray, it was written there. So we have bruises, we have lacerations, we have broken the fracture. Now, at our care, her wounds were stitched and dressed, and she was given Carvia 150, Panadol, and Normicin for the management of blood pressure, pain, and insomnia, respectively. Instead, you can just write she was treated conservatively, so no problem. Just now, we just said the medicines because it's a nursing service. We just said because it's a BP medication, this is a pain medication, and this is the insomnia medication. These two medications can be recommended if the pain or insomnia persists. And so this may be brought to the referral of the nursing service that these were the drug of choices. Now, this condition is very clear here, the condition and the treatment what we have given. Now, Miss McNamara is single-aged pensioner who finds it difficult to cope with her new accommodation in Unit 1586 Small Street. So we have written this particular thing, Unit 1586 Smart Street, is that there's a new accommodation. She's new there. It's not mandatory to write this address there. So as far as she is going to arrange a home visit daily to this particular area, so we have written it. It's not mandatory. So, although being visited by her niece every fortnight, she feels increasingly isolated and lonely. Just because she is finding it difficult to adjust with the situations in the new accommodation. So, this is the difficulties she faced, and this is her condition here. So she has some social isolation. She is feeling emotionally dull because of this thing. So the only visit she has is from her niece in every 14 days. It would be appreciated if you could organize daily home visits from your facility in order to assist Ms. McNamara in showering and wound dressing. So this is the reason why we are writing your letter, to organize daily home visit from your facility. To assist Ms. McNamara in showering and wound dressing, please be aware that she has her stitch removal and a review in the hospital outpatient department at 10:30 a.m. on this 31st. So we have to write the smaller time frame in the beginning and the bigger time frame later. So place this thing place this thing instead here. So this is something wrong there. You have to say the specific thing first, the greater thing later. In case of any further queries regarding this McNamara's condition, please feel free to contact me as faithfully. Grace Johnson, the name of the carer, registered nurse, Ward C25, Prince Alexander Hospital. You can say ward nurse or just nurse. So I have written just nurse there, nurse Ward C25. So that's the end of the session here. So I hope that we can see again with another letter soon as possible. Let's have a look at the letter as a whole once more, please. Thank you.